all. This lecture, I think this will be one of the last lectures on anatomy. In this, we have to deal with all the joints of the lower limb. Okay, so there are so many joints, so we have to know all these parts of each joint. Okay, so we'll discuss these joints. I will discuss the important joint first, and that's an important introduction. Beginning with the hip joint. It is many features are very similar to that of the shoulder joint. Okay, so always whenever you compare, you should keep comparing so that you can remember both the structures together as well as what are the differences. So you should know that the upper limb. Yeah. So in the upper limb we have the shoulder joint. Shoulder joint is very similar to that of the hip joint. Okay. So here is also a joint which is ball and socket just like that of the shoulder joint. Okay. And the articulation is between the head of the femur with something called as the acetabulum of the hip bone. Okay. So in case of the upper limb, it will be the head of the humerus with glenoid cavity. Okay. Here it will be the acetabular cavity. Okay. So this is the difference between these two. Okay. So this is also called as the acetabulo-femoral joint because this is the articulation between the acetabulum and the head of the femur. Okay. And here in case of shoulder joint, we have maximum mobility. Okay, we have maximum movement. No other shoulder joint in the body has so many movements like the upper limb. In the shoulder joint, yeah. Yeah, we'll discuss that. Okay. So it has maximum mobility, but the danger is it is very less stable. So always whenever you go to the clinical side, usually there will be dislocations of the shoulder joint. Okay, very common because of the one of the most mobile joint, and that's why it is also prone for dislocation. But this is also similar joint, but here there is maximum stability at the expense of lesser moments. Okay, so if you have more stability, then there will be less movement. There is less stability, there will be more movement. So this is the reverse. So here and here the difference is here it is more mobile at the expense of less stability. Here it is more stable, but the mobility is lesser. Compare the shoulder movements with that of the hip movements, they are less. Okay. So that's the disadvantage. Okay. So here there will be the articular surface. So these are the articular surface covered by the articular cartilage. You know the hyaline cartilage, which is bluish in color. So it will be the articular cartilage, and this is the glenoid cavity, and this is on the head of the femur. Okay. So here also you can see the articular surfaces on the side, and this articular surface in case of the glenoid cavity is very small. Okay, so there is maximum movements because of smaller glenoid cavity. Here the glenoid cavity articular surface is, instead of the glenoid, it is acetabular cavity, it is larger. Okay, in case of the upper limb, the glenoid cavity is just 1/3 of the head of the humerus. Okay, so very small cavity, so it can move anywhere. But here the cavity is much larger and the articular surface is much more in acetabulum. Okay, and this is again increased by something called as the acetabular labrum. So this is extended to the forward, something called as acetabular labrum. Below also it will be extended. So there is more cavity so that the head can move. But here there is more stability because of this, but the movement has decreased because of this. Okay, so one is the articular surfaces, second is the labrum, and third is because it is a synovial joint, so it will be covered by the synovial membrane. Everywhere is called the synovial membrane except at the articular surface. Except at the articular surface, the synovial membrane will not be there. Apart from that, everywhere it will be present. Okay. So, and
that's the extension of the joint.
Yeah. So this extension of the joint means the cavity, the acetabulum is increased in its cavity by a fibrocartilaginous structure called as the acetabular labrum. Okay. So it is an extension of the acetabulum. Okay. And finally it is covered by the fibrous capsule. Okay. So this stability is mainly because of the ligaments. Okay, means stability. Always the joints are stable because of the ligaments. So there are important ligaments. There are 7 ligaments here which will make it stable. One is the fibrous capsule, which is usually for all the joints. Okay. Then along with that, there are three important ligaments here. One is called as the iliofemoral. If you see here in this picture, I show the iliofemoral ligament in the front. Then we have the pubofemoral. Here the pubis bone. There is something called a pubofemoral, and behind, if you go, there is ischiofemoral. It is coming from the ischial tuberosity, so it is called as the ischiofemoral. So ischiofemoral is behind. So these three ligaments are very important. Iliofemoral, then pubofemoral, and then there is called as some behind. It is called as the ischiofemoral. So here you can see iliofemoral and pubofemoral, and behind it will be the ischiofemoral. These three ligaments are very important, which are specific to the joint. And if you remember, we have down there is a model, and in this we have seen there is the hip joint, and that joint is covered by three ligaments. If you see there is green structures in the model. Okay, those three ligaments are nothing but these three ligaments which are shown in the model. We go and once again see there is a hip bone model there. Okay, which is showing the joint, and it has three structures here. Green structures. Okay, those are the three iliofemoral, pubofemoral, as well as the ischiofemoral. Okay. Then along with that, the ligament of the head of femur, there is a small ligament. If you remember, when we studied the head of the femur, there is something called as the acetabular fovea. Fovea. If you see here, the head of the fovea, there is on the head of the femur, there is small structure, depression called as the fovea, which is for the attachment of the ligament of the head of femur. So there is a ligament which is running from the sternum up to the head of the femur. It is intracapsular. Okay. So there is called as fovea is on the head of the femur. It is a depression. If you see the head of the femur, it is not soft. At one particular point there is a small depression. It is called as the fovea. So this is for the ligament of head of femur, attachment of the ligament of head of femur. Okay. So if you see the previous slide here also there is. So it is the head, and there is a ligament running. This is called as the ligament of Gilles or the ligament of head, which is coming from the acetabulum up to the head. Okay. So this is the ligament of head of femur. Along with that, the labrum, we are seeing the extension of the then there is something called as the transverse acetabular ligament. You see here in this picture, this is the acetabular fossa, and down there is a notch. Okay, so this notch is converted to foramen by a ligament called as the transverse acetabular ligament. Okay, this is the ligament which will be converting it into acetabular foramen. Okay, so this notch is covered by a ligament called as the transverse acetabular ligament. This will prevent the inferior dislocation of the shoulder, the hip joint. Okay, so the head of the femur cannot come down because of this ligament. Okay, so that it prevents, so that's why it gives the stability. So all these ligaments, 7 ligaments are helpful for the stability of the hip joint. Okay, so whenever if they ask you the ligaments of the hip joint, then you should be able to name them. Okay, it is also a part of the ligament. Okay. Okay. Then, as I said, the stability of the hip joint is mainly because of, as I said, deep acetabular fossa. Okay. Then the labrum, which again increase the cavity. Then the vacuum effect between the hip bone and the head of the femur. There is a vacuum effect which will pull it towards the joint. Okay. So that vacuum effect also increases and the 3 major ligaments I showed you, that is the iliofemoral, pubofemoral, ischiofemoral. These all help in the stability along with the lower part which is controlled by the transverse ligament. Okay. All this help in the, as well as this has a very small role. The ligament of head of femur, it has a very small role, but it helps in mainly all these the upper part. Okay. Coming to the there are some important bursas around the hip joint. What is the function of the bursa? What are bursas?
Extension of the
Synovial fluid.
Yeah, extension of
Synovial membrane.
okay. Yeah, as it's
aponeurosis.
aponeurosis.
sac filled with
sac filled
with the synovial
synovial fluid. And what is the function? Why they are present?
Prevention.
They prevent friction between the ligaments or the muscles which are running on the joints. Okay, so if there are muscles pulling or the ligaments, so between the ligament there will be bursas, small bursas. So they give the ball-like movements, slow, frictionless movement. So there are bursas around the hip joint also. One is the subtendinous. We have bursa as well as the bursas around the gluteus medius, gluteus minimus, as well as the gluteus maximus. All these, each muscle of the gluteal region are related with one of the bursas. Okay. So coming to the nerve supply, all the joints, as you remember, all the joints which are covered or on which the muscles are acting, the nerve supplying that muscle also supplies the joint. Okay, that is the formula. So all the muscles which are crossing the hip joint, so the nerves which are supplying them will also supply the joint. So the femoral nerve, which is from the anterior compartment, then we have the obturator nerve, which is from the medial compartment, then we have the accessory obturator nerve, as well as the nerve of the quadratus femoris, as well as the superior gluteal nerve, which is the nerve of the posterior compartment, which is mainly supplying the gluteus medius and minimus. All these nerves will be supplying this.
Supply muscle and ligament.
They supply the muscle as well as the joint. Okay. So the femoral nerve, obturator nerve, accessory obturator nerve, nerve to quadratus femoris as well as the superior gluteal. So all has to be supplied.
Sources of communication.
Which one?
Other names? Sources of communication specified. First one.
Where?
Sources communication.
Versus? Psoas. This one? Psoas? Psoas major. Okay. Psoas major is a muscle. Okay. Which I had told you when I was covering the floor of the femoral triangle, it forms one of the structure which form the floor. So it is a muscle which is in the back, in the pelvis, and it will be coming in the front of the thigh. It forms the floor. One of the muscle which forms the floor. I had told you it forms a gutter-like thing which will pull all the structures. So out of the four muscles in the floor of the femoral triangle, this psoas major is one. So there is a muscle in the pelvis. Okay. So if you remember, I had shown you the picture also. You had come to me for the same psoas major muscle, and I had shown you. The picture is also there. If you remember the femoral triangle, there is a picture. If you go back to the lecture and see, there is a picture for that psoas major muscle. Okay. Coming to the arterial supply, it is mainly supplied by the obturator artery along with the median lateral circumflex femoral artery. These are branches here. So just like we have median lateral circumflex femoral artery in case of the axillary artery, okay, which gives branches around the neck of the humerus. Okay. Similarly, here also we have the median lateral circumflex femoral arteries. Okay. So this also supplies as well as the gluteal arteries, meaning the superior and inferior gluteal. All these arteries will be supplied. One is the obturator artery, then the medial lateral circumflex femoral artery, and the gluteal arteries. Okay. All these anastomos here, okay, they are all from anastomos around the hip joint, and they supply all the okay. The disadvantage is the neck of the femur. Usually, especially in case of old people, the neck of the femur is prone for fractures. And if there is any blockage of these arteries, it will slowly heal or doesn't heal, and that leads to permanent damage, especially in case of old people. Okay, it is very common in case of people who cross 50 and 60 and they have fractures of the hip of the femur. Usually it doesn't heal. Okay, especially one is because of osteoporosis, and second is the blood supply. Okay, so it rarely heals. The venous drainage is very similar to all these arteries. The names are same with the vein. Okay. Movements, as you know the movements already, the flexion, extension, abduction, adduction, median lateral rotation, and the circumflexion. So you should know the movements as well as the muscles causing these movements. Okay. So you already studied, when you studied each compartment, at that time we studied the movements as well as the muscles causing movements. Okay. So you should remember the movements as well as all the muscles which are related to this movement. Okay. Coming to the applied aspects, Again, I will not go into detail. These are the pathology part. I will just name them. Okay, so all these are the one is the congenital dislocation of the hip joint. This is especially common in some of the newborn infants. Every time there will be dislocation. Okay. Okay. Then there will be fracture of the neck of the femur. As I said, it is a old people especially. Yeah.
Response, that's why it is undeveloped for the joint and
Yeah, it is developed, but might be there are many causes for that. One is the ligaments themselves. There might be weak, and there are other causes also that you will cover in the pathology. You will not go into details. You just name them. Okay. Pathology disease. Then there can be tuberculosis of this joint, osteoarthritis, stiffness of the joint, neuropathic joint. All these are some of the apparent aspects. If you want details about those diseases, each disease you can discuss in the pathology. Okay. Coming to the knee joint. Okay. The second very important joint of the body is the knee joint. Okay. So why? It is the largest as well as the most complex synovial joint. Largest as well as the most complex as well as most unstable joint. Okay. So it's very important. Why? Because it is called as complex joint, because it is compound as well as complex because of two joints. One is two intercondylar joint, the condyles of the tibia with the condyles of the femur articulated, and one saddle joint. Okay. So the condylar joint is between the tibia and the femur, the condyles, medial lateral condyle of the femur will articulate with the medial lateral condyle of the tibia. So this is called as the femorotibial joint. The second joint is the saddle joint between the femur and the patella in the front. Okay, so this is called as the femoropatellar joint. So there are two joints within the knee joint. One is between the tibia and the femur, and the second is between the femur and the patella. So that's why it is a complex joint as well as it is. So this is one of the classifications which you might be knowing or you should know. Okay, so this is the classification of the joints. Okay, so the first is the fibrous joint. Within that fibrous joint there are three types of joints. In the cartilage joint there are two types, and the synovial joint there are so many, 7 types. Among this joint will be involving the sellar joint or the saddle joint as well as the bicondylar joint. Okay, so two types are involved within this. Okay, the articular surfaces for this is the medial lateral condyles of the femur. So these are two condyles of the femur, then the two condyles of the tibia. Okay, and the articular surface of the patella. If you see here, so this is how it is articulating. This is the articular surface of the femur, this is the articular surface of the patella, and the articular surface for the tibia. And these articular surfaces, as you know, are always covered by the hyaline cartilage, articular cartilage. Okay. And if you see the tibia, okay. So here, if you see, it is almost flat. Okay, and it has very shallow this thing. Okay, so the articulation between the femur has a round thing, but here it is almost flat. Okay, so here this makes it very unstable joint, very unstable because it can easily slip anywhere. Okay, so that's why this is made little stable by the presence of something called as the menisci. So here we can see the two menisci. Okay, medial as well as lateral menisci. These will slightly increase the shallowness of the condyles of the tibia. Okay, these are called as the menisci. So if you can see here, so they are increasing the concavity of the tibia is totally flat, almost flat here. So the menisci are increasing the concavity so that it can become little stable. And the other stability is done by the ligaments. We will discuss about the ligaments. Okay. So before we go to the ligaments, between the condyles of the tibia there are some important structures here which are attached. Okay. So you should know this area. This is called as the intercondylar area of the tibia. So you should know the structures which are there between these two menisci. Okay, this is called as the intercondylar area between the two menisci. So the first structure which you come across from anterior to posterior is the anterior horn of the medial meniscus. Okay, so there is the anterior horn of the medial meniscus. Okay, then we have the anterior attachment of the anterior cruciate ligament, one of the ligaments. We will talk about this cruciate ligaments. Then we have the anterior horn of the lateral meniscus. This is the lateral meniscus. Here is the anterior horn. Okay. Then we have the posterior horn of the lateral meniscus. Then we have the posterior horn of the medial meniscus, and then the posterior cruciate ligament. So this is how it goes. Okay. So here is the medial meniscus, anterior horn, then anterior cruciate, then the lateral anterior horn of the lateral meniscus, posterior horn of the lateral meniscus, then the posterior horn of the medial meniscus, then the last one is the posterior cruciate ligament. So these are the structures which are placed anterior to posterior in the intercondylar area. Intercondylar area is the area between the two condyles of the tibia. Now coming, as I said, this is the most unstable joint. So there are very important ligaments which will make it stable. So because it is very unstable, so there should be lot of ligaments. So there are a lot of ligaments here. So there are almost 13 ligaments which make it stable. So these are the ligaments. Okay.
No.
So these are the ligaments which will make it stable. Okay, it's not from me. It's by God. Okay, he has made it. Okay, so I have to tell them whichever is there. If it is less or more, whatever is there, we have to. Okay, so these are the ligaments which are present in the knee joint which make it stable. Okay, so these ligaments are most important for the stability of the knee joint. Okay, we'll discuss these ligaments one by one.
Doctor, you have to remove the previous picture.
Huh?
Go to the previous picture.
Yeah.
This picture, you have to remove it.
Yeah, you should remember this. Very important. Okay. Because they might ask you.
No, no.
Because yeah.
We can't edit on the lecture. We can't edit the lecture.
Edit?
There are some words.
No,
behind.
these words, these are only ligaments.
Only
All
ligaments?
ligaments.
Okay.
No, nothing else is there. Okay, so we'll discuss these structures one by one. One is the synovial membrane. As you know, the synovial membrane will be covering most of the joint except the articular surface. This is the articular surface. So the synovial membrane is shown in red. Okay, almost brownish red. So this will be on the sides, but it will not cover the articular surface. Okay, and this will continue suprapatellar. It continues as the suprapatellar. If you see here, this is the articular surface, and here is the synovial membrane, the remaining part. Wherever there is articular surface, it will not be there. Part of that it will be there. Along with that, this will continue above as the suprapatellar bursa here. So the continuation of the knee joint is into the suprapatellar bursa. Okay. Then yeah.
Cruciate is just a name or just
We'll talk about the cruciate ligaments. Okay. Okay. Then we have something called as the tibial collateral ligament. There is a very important